Good evening, everyone. My name is Elizabeth, the Education Coordinator for Marlene's Market and Deli. Tonight's special guest that we have with us is always an honor to work with. We have Kate Esparza Guerrero, and she's speaking on the topic of Medicare 101. So bring your questions into the live stream chat. And if you want to pop on the Zoom, I will put that in the comment section in this live stream. So thank you so much, Kate, for joining us.
You're welcome. And it's always a treat to do this. And I always, I started out doing it live and there at the stores. And I kind of like, oh, I wish we could go back to it. But then I don't know, this is also kind of nice too. So we'll see, maybe do both eventually. But anyways, so yes, as I was introduced as Kate Esparza Guerrero, some people know me as Kathleen. Back in the beginning when I began, I was using my license name. So sometimes I get calls or text referring to me as Kathleen, which is fine. Let's see, I went ahead, I was in the insurance industry of property and casualty for about 10, 11 years. And I was an admin assistant working in managing 3 different offices. So I was on the floor learning or hearing a lot about the sales part of it, which in the end, when I did get laid off, looking at new prospect of working as a Medicare agent, I loved the idea of being my own boss and not that typical sales agent part, where it is the hat of wearing as an educator, which for me means a lot more to me, because before I went into property and casualty, I worked in the Federal Way School District as a paraeducator for about 11 years while my children were in school. And when the last of the 3 was off in high school, that's when I went into property and casualty. So my passion, it really is the teaching part. And when I meet up with people individually, when people reach out to me, which is another thing, I'm not allowed to solicit. There isn't any, Medicare agents are not allowed to like put flyers on windshield wipers or the windshields or door to door. We're not allowed to do any of that, which for me, I'm relieved. I don't want to do that. We literally cannot speak to anyone unless that person reaches out to us. And then at that point, I'll meet with a person. I'll either meet them there at Marlene's, which I love, the Tacoma store or the Federal Way store. And then also meet people at study rooms in the libraries. I go into Tacoma, Burien, Renton, Federal Way, and Seattle. I do have some colleagues that I've connected with that also work in the Thurston County, Olympia area, all the way into down on the Washington Pacific coast. So I do have good partnership with some other colleagues that work in other areas. I'm not into traveling, so I do have other people that can help local residents in those areas. So the education part is a big part, and it can take a while when I meet up with people because we're going over their different health plans of what they've had, maybe medications, if they have medications, what's important to them, if maybe it's acupuncture, naturopath, or chiropractor. It's very individualized. It's very individualized, which that's another reason why I like my job, is that I am always learning. There's so much to learn out there in regards to just our health, or people with their different diagnosis, or even if they're needing medications. And there's different subpopulations that have different types of Medicare plans depending on what bracket they fit in. So it's a learning process all the time for me, which keeps it more exciting. It never gets dull. The dull part is certifying. Medicare insurance producers are required to recertify every summer. We have to go through several hours of dry reading, and we have to take an exam and pass it. And then after that, then depending on the insurance carrier we choose to represent, that insurance carrier has their own requirements or certifications. Let's see, for 2023, I believe there are 26 private Medicare insurance carriers. That's a lot of carriers. Needless to say, there are only a few that are the bigger carriers that a lot of you see advertisements on TV or you get flyers. And I want to represent the larger carriers because those are going to be somebody that has a history. And then that a lot of the doctors and hospitals are with that insurance carrier, or they accept that insurance carrier. So, and because these plans can be so individual, there's like one insurance carrier doesn't just have one plan. They have several plans, and each plan can have different options of what a person can choose. And so that's where the uniqueness comes. And that's where I get picky, or that's where I have my favorite plan that I'm going to, advise, like which plan would be best for you, which goes to, people ask, well, Kate, how do you get paid? You just spent like an hour and a half with me. And I like, don't worry, I'm no cost, no obligation. I just ask that when you are getting ready to enroll in a plan, that you reach out to me, and then I will help you with that enrollment. Then it is that private insurance carrier that then pays the insurance agent, the insurance producer, me. The beauty of that, which is another reason why I love this field, we as agents are paid the same across the board. It doesn't matter which carrier you go with, whether it's carrier A, B, or C, they all pay the same across the board. So there isn't going to be any of that like, oh, well, I'd love to have Elizabeth sign up for plan A because I know I'm going to get paid a little more. There isn't any of that going on. So it's going to be more about your individual, what your needs are. That's going to make my helping you on going with a good plan that's going to be good, a plan that's best for you. Let's see, what else? Oh, and then that's how I get paid, from that private insurance carrier. So that once Elizabeth enrolls in plan A, then plan A insurance carrier, they pay me. How do those carriers, how are they able to afford to pay us, the producers, the agents? Well, Medicare, your federal, original Medicare, your red, white, and blue, they pay a stipend to these private insurance carriers. And so depending on the carrier, again, the more that carrier, the more people that are enrolled in that carrier's company, the more money they have in their pool, that then they can use that money to richen their plans. So which brings me to talking about your original Medicare. So we're done talking about me and what insurance producers do, what they're allowed to do. And now it's into, well, original Medicare. So I really, I make it a point to call it original Medicare, because that is your federal red, white, and blue. And that looks like this. So that's going to be what, if you are eligible, you will be enrolling in Medicare. And so you're like, okay, well, what's that eligibility entail? So it can be someone who is getting ready to turn 65. When you turn 65, if you are enrolled in Medicare, let's say October is your birthday, your red, white, and blue card will show effective date October 1st. It doesn't matter what day of that month that you turn 65, it is always going to be on the 1st of that month. If your birthday lands on the 1st of, let's say it lands on October 1st, your Medicare card will show September 1st, 2023. Okay. Let's see. And also, if you're under 65, you can qualify if you have certain disabilities or special needs. So anyone who's under 65 that has been enrolled into the disability with Social Security for a total of 2 years, 24 months, then they are eligible for Medicare. And yet you have to be a US citizen or legal resident who has lived in the US for 5 consecutive years. And then, so that's the eligibility part. So as well as, looking for my notes, the accumulation of work hours. So Social Security takes 35 of the highest paid quarters that you have worked, and to equal 10 years worth or 40 quarters. And if you qualify with that, which the majority of us do, if we've worked like from our early 20s on up, and it doesn't have to be, also, it doesn't have to be like consecutive, it can be broken up, but just as long as it adds up to that amount, then you are eligible for Part A with 0 cost. I caught myself, I was going to say free, because it's not free, because you have paid into it through your work. But now, as you would be eligible, that Part A is without a fee. So this Part A here, right there, that is going to be no fee to you. Well, what does Part A cover? Part A covers hospital stay. Everything that happens in the hospital, you get admitted into the hospital, that is Part A. So then going back to the eligibility, let's say I'm going to talk about somebody who's aging in, is our term that we call age. Oh, that person's aging in, joining the special club of turning 65. Yay. So it is a yay, because it's really pretty easy to do, meaning if you are not pulling from your Social Security yet, you're not getting your Social Security payments, you are going to have to be proactive in enrolling. So let's say I have some, they're like, well, Kate, I'm working. Which is the situation for my husband last year. He's like, why do I need to enroll in Medicare? I'm still working. I have employer group medical coverage for both him and for me. And then I'm like, well, why not have both? Because if he does land in the hospital, he would have his employer group coverage. Let's say, I'm just saying, let's say they cover 80%, they will pay 80% of that hospital bill. Then that 20% would go to Medicare, and then Medicare would pay 80% of that balance. So then the remaining balance would be the responsibility for my husband and I to pay. So I'm kind of like, why not enroll? And mind you, the majority of employers don't, I think maybe because, I don't know, some of them don't really, they know, or they have the staff to really go over that. But like I have one client that has been paying her, she actually enrolled when she turned 65. And then she also enrolled in her Part B that she didn't need to enroll because she was still working. And so when my husband, or I did it for him, when we went online, I clicked the part online where it says, "Are you still working?" And I clicked yes, so that then when he was enrolling in Medicare to get his card, it was only going to show Part A on there, okay, not Part B. Because if you're still working and you have employer group coverage, you don't need Part B. Well, okay, so let's see. I'm not working now and I'm getting ready. I'm going to pull from my Social Security. I'm pulling from Social Security. I'm getting Social Security payments. And now I'm turning 65. Do I need to go online and enroll? Nope, you don't. If you are already pulling from your Social Security account, they already know. And maybe by the time when you call me, maybe a couple of months before you turn 65, I'm like, you know what? Keep checking in your mail because that card is going to be coming. You can see that it is going out because Social Security will automatically send you your card. Which brings me also to remind people the way you can check anything that's going on with your Social Security. And I recommend to everyone to please create an online My Social Security account. I've come across the majority of clients have already done that, which is fantastic. Because once you have created your My Social Security account, then when it comes time to enroll into Medicare, it's quick. It's so easy because to enroll in My Social Security account online, you would be going on the Social Security website, and Social Security is going to ask you questions to make sure that you are who you are when you are creating this account. You're going to come up with a unique username and a password. And that is how you will be able to go online then and pull up My Social Security. You'll be able to see all your work history, everything that we used to get mailed to us in the mail, and we could check our work history. Now Social Security is trying to get the majority of us, or soon all of us, to access that information online. So I tell everyone, you don't have to be turning 65. I mean, teenagers, people in their 20s and going forth, they all should be checking their Social Security because that's how you can also tell if somebody is maybe using your Social Security, which did tend to happen during the pandemic checks that were going out. I actually have a client where she did find that that was happening, and she was able to, when she went online to check her account, she saw a discrepancy with the email, and then it came to find out that somebody was using her Social Security to get those checks, and it amounted to something like $40,000. So it was taken care of. There wasn't any money taken from her Social Security, but there was a stop done to it. So, and then even if you have questions going forward about your Medicare, that's a good way that you can go online rather than having to call, which can be on hold for quite a while. So now that you have your My Social Security account set up, then when you go online to enroll in Medicare, you will be using that username and password to enroll. And you will either click that you want both A and B, or you're going to click just A. So then you're kind of like, okay, Kate, so I'm working, I've enrolled, I'm going to get my card on October 1st. Or what if I miss that sign up time? I'm like, oh no, it's now November. I forgot. That's okay. You can still enroll. And it's just that your effective date, it's not going to go back to October 1st. It's going to be the first of the following month. So just keep that in mind. For some people that are still working, no big deal, no big deal. For others, where they're maybe not going to have their Washington health care because now they're 65, it could be a matter of not having any Medicare insurance for a full month. So I really don't know anyone who's waited till after their birthday to enroll. I don't know why there would be that need if you're just going to be really aware that even if you're still working, you want to enroll in Part A. So then for Part B, now you're ready to enroll in Part B. You are really leaving your job, your employer group coverage is going to end. So then you need to have Part B. I'm not going to go into detail of what you need to do. I help people with that. It's not a big deal. There's a couple of forms that you turn into your employer and you fill out and you mail to Social Security. And then Social Security mails you a new red, white, and blue card that'll have Part A still showing the same effective date of when you enrolled. And maybe to the 2023 is now when you're coming on board with Part B. And let's say it's October 1st now for Part B. All right, so now, and that's where you can have two different effective dates, that there's a lot of people that have that on their card. So we talked about, I have this little, I don't know if you guys can see, it's not really very good. I got to figure out how to do that split screen where you can show things, but it's an actual bill that I have from the hospital of when my husband was in there. He's fine. But it was kind of like a wake-up call to me on the cost of being in the hospital for one day or one night. So it can be very expensive. So that being said, my husband's employer group coverage covered a pretty good amount of it. But if my husband had been enrolled, he would have had Medicare just paying 80%, just paying 80%. And it's like the pharmacy, lab, CT scan, physical therapy, emergency room, cardiology, magnetic resonance, all of that comes under Part A. So Part B then is everything else outside of the hospital. So when people, that's why you're going to need Part B when you're leaving your employer group coverage, because you're not going to have that medical, we call that the medical coverage. And it's everything else, your primary care, your specialists, your everything outside of the hospital, even the physical therapy, mental health, all of that is under Part B. And that Part B has a premium, which is why I stress to people, if you are working and have your employer group coverage, you don't need Part B, and you don't want Part B because you're going to be paying a premium. Everyone's like, a premium, how much is that? Well, it depends. It changes every year. We find out around October what that Part B premium is going to be. For 2023, that Part B premium is $164.90. There's a bracket, income bracket. They call it the standard is $164.90. If you are in the income level that is above that standard, your premium is going to be a little more. That being said, Medicare.gov, make that your best friend or click it as one of your favorites, that is the most legit, reputable website that you can go to find out Medicare information. And that's where you're going to see the table that'll list income and then how much your premium is going to be. So, but like I said, the standard is $164.90. So everyone has to pay a Part B premium. Doesn't matter what other insurance plan you have to always pay your original red, white, and blue federal Part B premium. You can pay it from your Social Security, whereas there's a lot of people that are like, if I don't see it, I won't miss it. I want it to come out of my Social Security before the rest is deposited into my account. You can have it paid quarterly by a coupon book. I've even heard some people, they go online later and they're able to pay with their credit card. I'm not sure about that. I'm gonna have to verify that. So that's to pay the Part B premium. And you have to have the Part B premium to be able to enroll in the private insurance carriers that are going to take care of the 20% that your original Medicare does not cover. So people are going, oh, that 20%, what's that? Well, remember, your original Medicare, the red, white, and blue, takes care of 80% of everything that is Medicare qualified. Okay, that 20% then is left up to you to pay. You have to pay that 20%, which can be a really high amount, depending, if you land in the hospital, or even if you don't land in the hospital. We all know how the costs can be pretty heavy for even going in to see a specialist. They'll only pay 80% and you have to pay the 20%. Okay. Also, another thing that original Medicare does not have is a prescription drug plan. And I have several clients who are like, well, Kate, I don't take any medications. And I'm like, that's fine. You don't have to take any medications if you have a prescription drug plan. What it means is that the federal original Medicare, they are requiring that you have a prescription drug plan set up for the what ifs or down the line, who knows. But either way, you have to have that. If you don't, you can acquire a penalty. I don't know anyone that has a penalty. Maybe there's one person that did, but he was in his 70s and he had not been educated about that. And the plans out there, because some of you are like, well, I don't want to have to pay for a drug plan. Well, the beauty of what you probably heard are Medicare Advantage plans. They have a prescription drug plan already embedded or bundled up in their plan. So whether you use it or not, you're going to be paying the same for that plan. And mind you, there are Medicare Advantage plans out there that are zero premium. So if you're already thinking like, well, great, so that's going to mean my plan's going to be a little more because there's a prescription drug plan in there. No, having a prescription drug plan bundled in with a Medicare Advantage plan does not determine the premium. Okay, you just want to make sure that you have a drug plan, because original Medicare does not have a drug plan. Let's see now. So we went over what the Part A covers, and Part B, outpatient care. Oh, and Part A does have a deductible, and Part B has a deductible. I won't go into details on that, but your private insurance carrier that takes care of that 20%, they take care of that deductible. Okay. Now, let's see, we talked about the Part A and the Part B. I don't want to spend too much time on this. Okay, Part B. And then the standalone. So there are standalone prescription drug plans. Well, why would I need a standalone prescription drug plan? If you choose a supplement plan, you would have to have a separate drug plan, which brings me into talking about your options for your private insurance plans. So the private insurance carriers, not all of them offer supplement plans, but the larger carriers do. And supplement plans, they are just the hospital and medical, okay? And so you have to then also have a separate drug plan. So that means when you're looking at costs, you're going to put $164.90, and then you're going to put supplement plan, and we call that the alphabet soup plan, by the way. And let's say you have plan N. So you would put plan N, $175, and then you have carrier B has a drug plan for $34, which is rounded up to the national average of a drug plan. So then you would be adding 164.90 plus 175 plus 34. Okay, so you're like, that seems kind of like a lot. It seems a little high, but then yet it's not if you are a person that's going to have a lot of visits to a specialist, and maybe you're going to have more than one outpatient surgery. So the big difference of supplement plan, or the big, I guess, bonus of a supplement plan that people that are on it, that have it, is that there aren't any copays. You don't have any copays. The copay part comes with the other option, which is Medicare Advantage plans. Medicare Advantage plans have copays. Okay, so going back to the supplement plan, and when I meet up with people, I show them, and there's, it's like a booklet where it shows the different plans. There's about 7, I think it is, plans, and it's alphabet, it's letter, it's not in order, because there's been some plans that came on, like Plan C, and Plan F has been removed, and now we have Plan G, and but those plans, depending on the carrier that they're with, the premium, that's where you see the difference in the premium cost. The plans are the same, whether it's Mutual of Omaha or United Healthcare that has a supplement plan, they're going to cover the exact same thing, of hospital or physical therapy. It's going to be the same. Where you see the difference is going to be in that company's premium cost. Okay. And let's see what else about supplement plans. They typically, there isn't any medical underwriting unless you are enrolling in a supplement plan after a couple of years of being on a Medicare Advantage plan, and then you're switching to a supplement plan. There could be some medical underwriting, and I'll go into that in more depth with any of you once we meet up. So that's pretty much it with supplement. Supplement doesn't offer all those little perks that you're seeing on TV. First it was Joe Namath, and then Stuart Anderson with Black Angus restaurants. Supplements don't offer, there is chiropractor, but like naturopath and dental, they don't offer that. Okay. So that is it on the supplement plan. So now, what I do with clients also when we're writing on the paper there, the costs of the supplement plan, and then we go to the advantage plans. And so you're going to have your Part B premium, $164.90, and then your Medicare Advantage plan could be $0. And so people are looking at me and they're like, that's it? $0? And I'm like, yeah, you're not paying for a separate drug plan because the drug plan is already bundled up in that Medicare Advantage plan. Not all Medicare Advantage plans have a $0 fee. Some of them, they range from $45 to like $60 a month. But each carrier that I represent has a $0 premium plan. So then people are, excited about that. And they're like, gosh, so then what's the main difference? Well, the main difference is there are copays. And the copays, it's because it's based off of HMOs. HMO stands for Health Maintenance Organization. I don't know how long, I've lived here pretty much most of my life and grew up in the Pacific Northwest, where it was not Kaiser, but Group Health. And group health was considered health maintenance organization. And back then in the day, in the 70s, the majority of my dad was a Boeing engineer, and he was pretty much, no, we're going to have a preferred provider. We don't want health maintenance organization. And there was some kind of slang terms thrown out there for group health. But now group health is completely has grown, and the name Kaiser Permanente, which is, I have several friends with KP, I guess that's the nickname, and are very happy. And it's a really good program for people who choose KP. But health maintenance organization, that template has been adopted by all of the big Medicare insurance carriers. And what does health maintenance organization mean? That means network. So back in the old school, network was really, really small. Now it's huge. University of Washington, St. Francis, Virginia Mason, Providence, all of those, Good Sam, all of them have network. They are in the network of these larger carriers, Medicare insurance carriers. Typically, when I meet with people, they give me the name of their specialist or where they like to go. And if they're in the network for United Healthcare, they're usually in the network also for Aetna and Humana and Regents. And so it's a big network. Okay. So don't let that part, the HMO, scare you away. It's not what it used to be. And it's great because then you really have more choice of going to different places. But there are copays. And you're like, oh, copays. Well, again, depends on the plan. There are companies out there where their plans, you go see your primary care, 0 copay. You go see your specialist, $35 copay or $45 copay. It can vary by $5. There's just a small range of variants of what those copays are. And of course, it's going to depend on what your monthly premium is, right? So then we look at that because that's the medical part. You'll be looking at outpatient. They're all flat fees and they're copays. And also with Medicare Advantage plans, they call it the MOOP, maximum out of pocket. And what does that mean? What that means is that through your year, you're paying a copay and your copays add up. But on a daily, average, year, your copays aren't going to add up to very much. Even if you have outpatient surgery, it shouldn't be more than maybe like a few hundred, $700, and that's including an outpatient surgery, maybe 1,000. I'm just throwing that out there because the maximum out of pocket allowed, again, these insurance carriers can, I say, play with that amount as long as Medicare says cannot go above 8,000. I think it's 8,700 for 2023. But Medicare says, okay, private insurance carriers, you can have it as low as you want, though. You can have it as low as 6,500 or 5,700. So then you're like, well, okay, what does that mean? Is that a deductible? No, it's not a deductible. Just remember that. Some people keep thinking it's a deductible. It's not a deductible. It's the amount of copays that you've paid. And once it's added up to, let's say, 5,700, once that copay is added up to 5,700, you paid that much, then the insurance carrier takes over and pays the rest. So you're kind of like, well, I'm not gonna, I would hope that none of my daily every day, maybe going to my doctor once a year. It's not going to add up to that. And like, you're right, it's not. What it means is, let's say if there's an accident, and it can be, any kind of accident that lands you in the hospital and has, rehab going on, that cost can easily, your co-pays could add up to that. Let's say you're diagnosed with a chronic or terminal illness, and you have to go in for IV treatments. It could add up to that amount. And then that's when the insurance carrier takes over and pays the rest. Okay. And that's annually, that's every year. Okay. So that, let's see, I think I've covered, so then the extra perks of a Medicare Advantage plan is, I used to compare it to like a menu. You go and you buy a la carte, which is your supplement plan, versus all in one meal, where you get your meal and your drink, which is your meal is your medical and your drink is your prescription. And then you get a prize, and that prize is all the extras. And the extras are dental, vision, chiropractor, acupuncture, naturopath, all of those little extras that we see advertised on TV all the time. And dental, which brings me to, and I stress this to people, if you're getting ready to retire and lose your employer group coverage for dental, please utilize as much of your dental coverage with your employer, because unfortunately, and there isn't any Medicare Advantage plan that I feel allows enough coverage for our dental health care. And there's plans out there where there's a maximum of $2,200 a year. And for a lot of us that are needing to go in more than twice a year for cleanings and maybe some implants, that's not enough. So I stress to people, use up all your employer coverage for dental before you lose it. But still, the Medicare Advantage plans are great for the dental and vision and hearing. And silver sneakers, to go to the gym. So I think that's it. The prescription drug plans, I'm not going to really go. The prescription part of the Medicare Advantage plans, maybe you've heard of the term formulary. And that's where the pharmacy companies and different regulators get together behind closed doors and decide, like, what level is Eliquis going to be? Or is this medication still on a patent? And if it's on a patent, it can't be a generic drug. So we're going to put that in a tier, or tier 3 or tier 4. So that's where you may have heard about prescriptions, medications being tiered. So there's a tier 1 through 5, and most of the medications are generic that people use, which is a tier 1 or tier 2. And with the Medicare Advantage plans, if that person is needing that medication, there's a $0 copay, or maybe a $5 copay. Again, it depends on the plan you're with. I'm not going to go into the details of, like what they call the donut hole. That's kind of, it's just, I'm not going to go into it unless you need it for me to talk about it. So then after that, so there's a prescription drug plan that's embedded in the Medicare Advantage plan. And so that's it for the difference between the supplemental and the Medicare Advantage plan. So then now you're like, okay, all right, I know when I need to enroll for when I'm aging in. But what if now I've already aged in, I didn't enroll, but I'm losing my I'm going to lose my health care with my work. So I'm going to enroll in Medicare now. I didn't enroll in Part A, or I did enroll in Part A and I need Part B. Do I have to wait for a certain time? Nope, you don't. You qualify for what we call special enrollment period, SEP, which means you can enroll anytime during the year because you qualify. People that are moving, maybe all of a sudden financial status changes and you're needing to have some state assistance, or certain health conditions, chronic health conditions, or even disasters. We actually are now, our clients are allowed in some counties what we call, because of the fire hazard, that a disaster, that people are allowed, if they need to make a change, they would qualify under a special enrollment period. And then there's the annual enrollment period that we are getting ready to gear up towards. It starts October 15th and goes through December 7th. What's that for? Well, that's for people that are already enrolled in a Medicare Advantage plan and they want to change, or that's somebody that's on a supplement plan and they want to change to a Medicare Advantage plan. You can change your plans as many times as you want to between October 15th and December 7th without any medical underwriting. It's a guaranteed issue. Okay. So after December 7th, you're tootling along, and then you've enrolled in a Medicare Advantage plan, and you think you like the plan that you're on, and then come January 1st, 2024, you find out your doctor is leaving. And let's say your doctor is now moving out to more of a rural area and is going to have his or her own office, and they don't take this particular carrier's Medicare Advantage plan, but they take this other carrier's Medicare Advantage plan, you need to make a change. You also would qualify under what we call open enrollment, OEP, which is January 1st through the end of March. So you're on a Medicare Advantage plan and you want to change again, you can. One time though, only one time. It's not, you can't change more than once like you could during annual enrollment. So Medicare, they came up with that about 3 years ago. We think, us other agents think, it's because people that went online to do their own enrollment, it's a tricky thing, right? And maybe they made a mistake, or they don't like the plan they're on. There's that other option then for open enrollment. So we have initial enrollment, where you're aging in. They call that an IEP, initial enrollment for aging in. And then we have annual enrollment and open enrollment and special enrollment. So that, let's see, I think that's it. How do we do? Ooh, I did it. I made it under an hour. I was hoping to only go like 45 minutes because it's a lot of information, but here I am. Thank you. I can't hear anyone. Oh, okay.
Oh, there we go. Thank you very much, Kate. I always learn so much, and the information that you provide to the community for free is so invaluable. And there's so many people out there that don't know what to do. And you lay it out in such a wonderful way, with humility and understanding, and you're much appreciated.
Oh, thank you. Thank you, Elizabeth.
You're welcome. I'm gonna check the live stream here real quick, see if we got any questions.
Absolutely. That's great.
And folks here in the Zoom meeting, you're welcome to use the chat features if you happen to be shy, or unmute yourself. This is an interactive platform.
Yeah, I don't, maybe, I know when I've done Zoom meetings before, I forget to unmute myself when I want to ask a question.
I do the same thing, like I just did.
Yeah, and and thank you for the compliment, because I really am sincere when I say that education part is really big for me, because like I met a couple last weekend at the Renton Library, and I just felt really bad for them because it was a situation where the husband is at a workplace where he's having to switch to a different position because of an injury, and he's aging in, but then he wasn't sure if that new position was going to offer their health care, and he's concerned about his wife who is diabetic. And it turned out that he didn't have any information, and so he actually, they're going like a full month of maybe no coverage at all. And it
Oh,
wasn't until I sat with them and talked to them about what original Medicare was, and they didn't realize that they needed to have the Part B. So they do have the Part A. It was just the Part B that they didn't realize they needed. And it is that employer group coverage part that sometimes can be a little tricky. Some employers, they, like my mother-in-law who worked for the Postal Service, um, bless her heart, she's 97. And back when she retired, there wasn't any HR that came to talk to her about how important it was that she enrolled in Part B, and or even in Part A, and she ended up having a penalty. But there wasn't any education part in that. So um, I really value this role in helping. It's gratifying that when I am, and that couple, um, I'm meeting up with him again when he finds out more insurance, and we're gonna get them on board. But it just is kind of a wake up call of how much is left unknown for so many people. And you think about the people where they don't have someone helping them.
yeah, exactly. And I feel like it's like Medicare is kind of like um this thing off in the distance that no one really talks about or no one really knows about.
Yeah.
And then once it gets here, everyone's like, well, what do I do now?
Yeah. Yeah. I've had that where people are like, they procrastinate, and it's not intentionally. It's just like it's so overwhelming. It's just so overwhelming because they're thinking about retiring, and they're thinking about, do I pull Social Security now or do I wait? And it's just so much. It's just a lot.
Exactly. But here you are, giving your time and energy and wonderful knowledge to all of us. And we are
Yeah.
all very grateful.
Okay. Well, if anyone has any questions, to type in, or if not, that's fine. You can call me, and I'd be more than happy to meet up with anyone and just go over any questions. Again, it's no fee, no obligation either.
Which is so wonderful. Here, I know I put it in the live stream, but I'm gonna make sure that folks here in the where did I put it? In the Zoom meeting here. Here we go. That's your contact info. And that's just so wonderful. You're offering your time even after the class, and then, further, with deciding what is going to be the best for them and what's going to fit their best needs. Because health is wealth, and to have Medicare available, which is just amazing in itself, but there's so many different ways of doing it. And so you are our um, Medicare guru.
Well, thank you. Yeah, and oh, I tell people, Go ahead and send me a text also. I do make it a point to look at because I have on my cell phone a business line. And so it has a little red flag that comes up when a text comes in. And so, of course, I see it right away. But if there's a voicemail message, a little red flag doesn't come up. And it's like, oh, if I don't check, I could miss a voicemail message. So there's been times when sometimes it's been a couple days before I've gotten back to someone. And I really try to get back to people within 24 hours.
Perfect. Well, it looks like I have no questions on the live
Okay,
stream, but folks know how to get a hold of you. And
great.
like what you were saying, you're willing to go all over, which is even more amazing because you're amazing. So thank you, Kate.
You're welcome.
Well, I hope everyone has a wonderful evening. Thanks for tuning in, and stay healthy and happy. Goodbye.
Bye-bye.